So let's talk about vanishing twin. Let's begin from there, right? Vanishing twin syndrome. That's what we're starting with. Vanishing twin syndrome. It's one of those pregnancy findings that can cause uh, some people to be frightened, right? It does sound frightening at first, but in the reality, it's quite common and often harmless, especially when it happens early. Some of you may have heard it, you didn't even know it happens. but but let's talk about it tonight. So what does vanishing twin really mean? What does vanishing twin really mean? Now, vanishing twin means that the pregnancy started as twins, but one of the embryo stopped developing and was gradually absorbed by the mother's body or by the surviving twin, right? So that's what vanishing twin is. In other words, you were pregnant with twins, but somewhere along the line, one of the twin stopped growing. And of course, if it stops growing and there is a viable pregnancy, viable twin, either the mother's body will absorb that one that stopped growing or the viable twin will absorb it. So that's basically what vanishing twin is, right? And one or two persons have actually experienced that and you're so confused. Say, how come? What is this? Right? So tonight is the night you get clarity on that. So in this case, instead of two babies continuing to grow, only one will progress and the other will vanish on ultrasound scan. Maybe in your early pregnancy, you were told that, hey, madam, you're going to have twins. And you're so happy. You're rejoicing. Oh, boy, you hit a jackpot, right? And by the time you go for ultrasound scan again, much later in the pregnancy, the person is telling you that it's just one. And now it's really confusing. Why? Because either the first person lied to you or the person is not professional enough. Right? so it's really confusing. It's really confusing. So who is that? Uno Christine. We talked about twins in details one time, but just stick around, you'll learn something. Is that okay? So how does it usually happen? This vanishing twin, how does it usually happen? Right? Please, let's tap on our screen. We've stopped tapping. My people will say it's because they are writing. Okay, while you are writing with this hand, please be tapping with this hand. So I think that's the way we should do it. I think that's what we should do. So how does this vanishing twin, how does it happen? Right? That's what we want to talk about. Those of you in the FYP, I see you. You're welcome. You want to jump in and tap so that we can reach more people. So most cases occur very early. Most cases of vanishing twin occur very early, often anywhere around 6 weeks of pregnancy to 9 weeks. 9 weeks of pregnancy. And a typical scenario of this vanishing twin goes like this. Yeah. You have an early ultrasound showing two gestational sac or two embryo. Like I said earlier, you must have gone for ultrasound. They saw two gestational sac or even two embryo in their separate or single compartments, right? Then a later ultrasound scan shows only one viable fetus. The second sac would have become smaller, sometimes even collapse. In some other cases, disappear altogether, right? So by the second trimester, many women may never even know that they initially carried twins unless they must have done earlier ultrasound, right? So if you are not the type that do ultrasound early, you may not actually know that happened to you, but it does happen. Just a few people who come for ultrasound early must have experienced this situation. So the question now is not so much as there is vanishing twin and why it happens, what caused it. So let us find out why it happened. Why does one twin vanish? Is it diabolic? Is it some spiritual stuff? It's not. Like I always tell people, first, before you begin to blame anything diabolic, make sure you must have exhausted all the scientific basis, right? Because even the spiritual respect principles, and science is the study of the principles that bring about these things, right? So why does one twin disappear? Why does one twin vanish, right? In most cases, right, is actually nature correcting itself. Remember, for those who have been here, I told us that the body has a quality control, quality assurance system, right? The body has a quality control, quality assurance system to see to it that the pregnancy that is being formed is supposed to be what it is genetically. There's no extra chromosome, there's no less of chromosome. It's supposed to conform to the 46 chromosome and so on and so forth, right? So I said all that then. So in most cases, for this vanishing twin, it's just part of what we talked about, nature correcting itself. There must have been an error. So nature is trying to correct itself. It's not something that the mother did wrong, or maybe as like those of us religious people will now begin to blame wicked and bad people, right? So the common reasons why this happens, right, is Navamami, right? We discussed your case last week, but I don't think you have a problem. I don't think you have a problem. Anyway, when it's time for questions, you come up, we'll talk to you, right? We'll talk to you. But please go and see your doctor. If your early morning sickness is too severe, go and see your doctor. So the common reasons for why the twin may vanish, like I mentioned, chromosomal abnormality in one of the embryo. Chromosomal abnormality is the body's way to assess the chromosome. Is it coding? Is it having the right human coding? If it's not, it will be terminated, right? So one of them may have abnormal chromosome constituent, therefore the body will terminate that one. Another reason is poor implantation in one of the sac. So of course we talked about the details of implantation, and if implantation is poor, definitely the pregnancy will not progress, will not continue. So in this case, one of them may have that kind of situation of poor implantation of its sac. So what happens? No proper nourishment, no proper hormonal support, no proper blood supply, then that fails. All right. Then there is also the reason of abnormal placenta development. because once the implantation occurs, that location is where placenta begins to develop. And when placenta is not developing properly, placenta is the organ that will take over from the yolk sac for the nourishment and support, right? Right. So if it's not properly being developed, it means that the success of that particular twin will not continue. So that twin may vanish, right? I like the word vanish because it gets people really interested in what is this vanishing twin. And there's also the issue of limited blood supply to one of the twins, right? If there's limited blood supply to one of the twins, that one will suffer loss. It will even stop growing, then it will vanish, right? So the body will recognize that one of these embryo is no longer viable. So you have twins for some reason, or rather the reasons I just gave. One of them stopped growing, but this one continues to grow. So along the line, the body will recognize that this one is that Lady G. Lady G is here. So the body will recognize that this one has stopped growing. So what does the body do? It begins to remove it from the system. Whether it's the mother's body that is absorbing it or this particular one that is still growing can also absorb it. So that is how it happens, right? So now, would the mother feel anything in a vanishing twin situation? Would the mother feel anything? Oftentimes, the mother feel nothing. The mother feel nothing oftentimes. But some women may notice mild abdominal cramps for obvious reasons, right? Mild abdominal cramp. Remember, it's just one of the twin that is vanishing. The other one is very viable and is still progressing. So the body will find a way to strike the balance between this one that is vanishing and also supporting this one that is still growing. So the mother will feel mild abdominal cramp. Good evening, Boss Jane. You are welcome. Some women will have a light vaginal spotting. All right. So if you were here when we were talking about the difference between spotting and implantation bleeding, you already understand the details of that. So some women will have light vaginal spotting. All right. The symptoms in this case will be similar to threatening abortion, right? So when we, first the patient may come in as like with symptoms of threatening abortion, but when we do the examination, the ultrasound scan, we just discover that, oh, madam, it's actually a case of vanishing twin. So they will give you the assurance. And Daniela, if they have the same placenta, the only reason why they could be vanishing twin would be because of chromosomal abnormality. Well, because the placenta already is supplying the both of them adequately. So just follow what I said. I'm sure you're just coming, so you don't get the other part, right? So like I said, the symptom may appear as threatening miscarriage. Thank you, Boss Jane. It may appear as threatening miscarriage, but by the time we do the ultrasound scan and examine you, you just discover that, oh, this is a case of vanishing twin. And of course, you will be reassured. You'll be reassured, right? So what happened to the vanishing twin? To the twin that is vanishing, that vanished. What happened to that twin that vanished? Anyway, I know it's more dependent on the timing of its vanishing. All right. If you're just joining, you're welcome. This is a place where um, pregnancy is possible. Do not ever think your case is hopeless. It's not hopeless. It's not hopeless. Just talk to us and we'll help you. Is that okay? All right. So where was I? So I was saying that what happens to the vanished twin is actually dependent on the timing, right? In a very early pregnancy, it is completely absorbed, leaving no trace. If it's happening in a very early pregnancy, right? So you may not even have any trace, completely absorbed by mother system or even the viable twin, right? In the later first trimester, right, this has gone beyond very early pregnancy. So later in the first trimester, if that is when it's vanishing, you could have remnants that would appear as a flattened sac or even placenta tissue appearing there. I wish I could share some images, but that would be too. Like, I can't do that right now. But in the later first trimester, because the sac has been established, some structures have been established, and now the twin is vanished. So that compartment, that room, it will still be obvious. You know that yes, 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 something happened here. So that's how we get to know that, madam, this is a case of vanishing twin. Right, right. Now, if the vanishing twin, right, if the vanishing twin happens in the second trimester, which is rare though, if it happens in the second trimester, and remember it's rare, it's not a common thing for twin to vanish at second trimester. But if it does happen at that time, it may persist as kind of a small compressed structure, right? It will just persist as a small compressed structure. You can tell something is up here. In fact, we call that fetus papyraceous. But don't worry about the name. Don't worry about the name. I always tell you, don't worry about the medical jargons. Just understand the concept, and you will be surprised how the knowledge work for you like magic, right? All right. So I said all that to say that in early cases of vanishing twin, by the time of delivery, there's usually no evidence at all that there was even twin at all. Not to talk about it vanished. Right? It's only in later cases where you can have some premonition that something happened. Right? So that leads us to another question. Is the surviving baby affected? Right? Because remember, two fetuses begin to grow. Is that Chrissy? Chrissy is here. Right. So we have two embryo that started growing. Then for some reason that I gave, one of them vanished. So if one of them is vanishing, the thoughtful mind would think, would anything happen to this one that is surviving? Would anything happen? Would it be affected? Most of the time, the answer is no. Most of the time, right? All of you that are asking questions, exercise patience. The only way to learn on this platform is patience, right? If you're not patient, you will not learn, you will not get any result at all. And I guarantee you, the things that you refuse to learn here because you're not patient are the things you're going to spend money. We're giving you for free. You go and spend money for somebody else to tell you about them. Right? So calm down. Be patient. But if you are still not patient, you can always send me the money. I will spend the whole month educating you and directing your words on what to do. Patience, patience. Because I'm not just talking to only you, I'm talking to a global audience. So I want to give everybody opportunity, the same opportunity to learn something. Is that okay? So let's do it that way. So I said, most of the time, the surviving fetus usually is not affected in any way. So when vanishing twins occur early, what you have is the remaining baby usually develop normally, normal heartbeat, normal chromosome constituents, normal structure and all that. The pregnancy outcome in this case is often the same as when you carried a single baby, right? Not that something really happened and this one is deformed. No, always almost the same as a single thing. Is that okay? And there is usually no long-term effect or after birth outcome that will tell that you had a vanishing twin. No, it does not affect the baby in any way. Right. All right. So that these are the issues about vanishing twin. And now that I've put it out of the way, let us now go and discuss. Let's continue. Last week or last Friday, we ended the first trimester pregnancy, all the details of first trimester. So now we have arrived at second trimester. So we are going to look at all the story of second trimester, and we're going to give you blow by blow details of it. Is that okay? And more likely, those of you that are asking your questions, more likely by the end of the discussion, you just discover that we have answered your question. That's why I always advise people, be patient, because whether you like it or not, here you will learn. So in these few minutes, let us tap on our screen before we begin the second trimester gist. Because in this second trimester, we're going to start with when pregnancy, all those symptoms that we talked about in the first trimester. Most of them will go away, and the new sets may begin to trouble you. But long story short, when the pregnancy starts feeling scary and you start feeling that wow, I'm really, really, really pregnant. So tap on your screen, share the live. If you not drop your heart me, this is the time, please. On the screen, they smile and cry. A first hello before the lullaby. She finds out it's a girl, been waiting so long. He sees his son, says I gotta be strong. Sometimes it ain't the dream they plan, but they hold on tight, love close at hand. It's a joy and a storm, it's hope and it's pain. Tears in the sunshine, love in the rain. Every scan's a story, old souls and new. I'm just a witness in the heartbeat blues. All right, so welcome back from the brief interlude. So tonight we are beginning our discussion on second trimester pregnancy. All right. So if you are here, 3 things you must do: tap on your screen, follow me, share the live. And if the information I share with you every night makes sense to you and is beneficial to you, it's only wise for you to drop a heart me. For me, that shows that you appreciate what I'm doing with you. But regardless, let us continue. So let's begin our second trimester gist. And by the way, second trimester is anywhere from 14 weeks to 27 weeks. First trimester is anywhere from 0 to 13 weeks. Then third trimester is anywhere from 28 weeks to 36 weeks. Then term is 37 to 40. Anything above 40 is post-term. Is that clear? I hope that is clear. So we are looking at the details we are going to begin to discuss from tonight. Is anything from 14 weeks to 27 weeks of your pregnancy, right? So the most delicate part of pregnancy is the first trimester. So now when you get to this point, just imagine it as you are surviving a storm. You survive a storm, and suddenly the sky just clears out. So this is what second trimester is like. You just came out of the storm. The most delicate part, that first trimester. Several things we said. Oh boy, if you missed our first trimester gist, you have to wait for several months before we go back there. Right? But nonetheless, just continue learning from where you met us. Is that okay? So the second trimester is our gist. And if the first trimester felt like the things you felt was like nausea, you felt fear, you felt confusion, even endless question, because even on the live stream I had plethora of questions to answer in that first trimester, right? So in the second trimester, this is when the pregnancy will finally say to you, relax. I've got this now. The pregnancy can handle it, right? So I want to reassure you. So relax. We got this. Right? So this is a stage where many women will remember. If first of all you remember where you're coming from, right? You remember where you're coming from, but this is the stage where everything begins to make sense to you, because there's no more confusion, there's no more fear, there's no more endless questions. In fact, the storm at this point may almost be over for some people. Why for some people it continues, right? This is actually a golden, we got that golden trimester, right? You are in your first trimester, okay. We just left there last week. So we're in second trimester. You want to learn about second trimester. So around 14 weeks, something powerful begins to happen behind the scene. Remember, 14 weeks is where the second trimester starts. Behind the scene, whether you know it or not, something powerful begins to happen. Here, the placenta takes full control. Remember that the placenta was not always responsible for the pregnancy. But by the time it arrives at second trimester, the placenta takes full control. In this place, what you have as hormonal ups and downs, the turmoil of hormones, right? The hormone will stop swinging widely. There's some level of stability, right? That is the reason why some of you begin to feel much better as against the kind of things you felt in your first trimester. The body at this stage of second trimester, at this stage, the body adapts to the pregnancy. It's no longer strange. And I'm also talking to those who are conceiving for the first time. When you get to this stage, your body now adapts. There's no fear of the body is trying to reject it. Nothing will reject it again, right? So the body adapts to the pregnancy. The baby begins to grow. Regrowth begins at this stage, not just the formation. Remember, In the first trimester, that is where the blueprint, the template for this human structure is laid, and the foundational blocks are also laid. So by the time you get to this stage, we are gone past the foundation and the blueprint. And that is why I took time to tell us about the things or drugs that can harm you in that first trimester. Because anything that distorts that foundation or the blueprint will have a long-term effect. That is, if it does not end in miscarriage, there is a long-term effect that the baby may come with. So at this stage, the baby begins real growth, and we've gone past the foundational stage, right? And one of the things you understand is that more than 8 out of 10 pregnancy that reaches this stage will continue safely from here on. And that is a remarkable number. Out of 10, 8 will continue safely. So we are out of the storm, right? All right. So if you are still here, please talk to me in the comment section. Say I'm here. Let me be sure you're here and you're learning something. And I'm not seeing the tabs anymore. Please, let's tap on our screen. If you are still here, please talk to me that you're here. When you talk to me, I get to remember your name, right? Malanga. Is that Mlanga? That's Mlanga. Mlanga, okay. Miss. All right. All right. Boss Jane, I see. All right. So let's continue. Yes, you should follow me. You should follow me. You know, every day I notice a lot of people who listen to me, but they don't follow me. And I want to ask you, why are you like this? Tell me, I want to know why. Why are you like this? Right. Anyway, so where are we? Let's talk about what the baby is doing at this time. Remember, in the first trimester, we formed the framework. We look at the development of the brain, the spine, the lungs, the heart, and all those things that were being created or forming rather. But now let's look at what the baby is doing at this time. Yeah. So that's why I have this picture here behind me, because it looks just like this. So what are you doing? What are you doing? What are you doing at this stage? I want to know what my baby is doing. So we are actually in this stage. We have moved from blueprint, and now we're now getting to that movement of a little human being inside your belly, right? So by now, the baby is no longer just forming organs. We have gone past that stage. Now the baby is actually using those organs that were formed. Yeah. So if for any reason you did anything that caused a malformation earlier, this is where they begin to manifest and start causing trouble. You don't want that to happen, right? So in this stage, the baby is now attempting to use the organs that was formed. Now the baby wants to use them. The heart is beating steadily, right? And the heartbeat at this stage will range from 120 beats to 160 beats. Yeah. And that is, you just continue in that steady beat. The brain, remember, the brain is continually forming though, and it stops forming. It just continues even after birth. It continues forming. Now, because it's one of the first things that were formed, by the second trimester, it has started firing some signals. So the brain now also is still being used, right? Signals, real signals are being fired from the brain. Muscles moving on purpose. This is the stage where you have the baby can stretch the hand, stretch the legs, extend the back, right? This is the stage where the bones are growing stronger every day. You know, at the first, the baby is in the first trimester, the baby is kind of, let's leave those sides because it will not matter to your knowledge. But I will say all that to say everything that were laid now is beginning to form properly. Now look at some people will come and say, "Oh, doctor, I'm pregnant and I'm not feeling my baby move." What I always tell them will be, I hope when the baby starts kicking hard, you will not now come back and say this baby is kicking too much. Let's check again. I hope so. because that's always what happens. From I'm not feeling my baby kick to, oh, this baby is kicking too much. So what do you want? It's a good thing. It's a good thing for your baby to kick. It's a good thing, right? So the first movement of your baby, what you feel. In fact, this basically one day you will just start feeling something, right? But that movement usually will begin anywhere from people's experience, anywhere from 16 to 22 weeks, right? One day, something just happened. You just feel like some kind of flutter inside of you. Now, what I'm talking about tonight is something that no man, 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 would ever have experience of. So if you're a man here, God bless you, at least you have, you learn something today. But this is experience that is particular to women. It's only women that have felt it, understood it, and they are still in the business of it. So for men, it's just in the hearing, right? So one day in the pregnancy, second trimester, you may just be feeling flutter. In other cases, bubbles. You feel like there's some kind of bubble movement, right? Then for some others, you feel some tiny taps here and there. Then for some others, you feel some light rolling. Well, some may feel all the things I just mentioned. Some may just feel one or two of them. So it's not the same for everybody. But as I'm mentioning it now, those people who have been pregnant, they understand exactly what I'm talking about. In fact, when this thing is happening, some women will stop and think, what's going on? Was that my baby or was that my stomach? You say, maybe na the beans where I chop and they cause gas. Or maybe it's the food that is causing my intestine to move. But no, your baby has started moving. All right. Ufoma Vivian, thank you. All right. You know what? This stage, this 16 to 22 weeks, all of a sudden movement that you started feeling, you know what it's called? It's called quickening. It's called quickening. Right. So it's often that this feeling is usually the first. Zini P, thank you very much. Thank you. This feeling is usually the first emotional connection mothers have with their babies. Right? Okay, let me throw a stray bullet to mothers. You see this first emotional connection? they will continue to use it to blackmail that child until they are old. Say, I am your mother. I know what I went through. I carried you in my belly. Mothers, I greet you now. Anyway, it's actually the first emotional connection. And you not blame women for doing that. If it's easy, let men go and carry Belemogusi. Right? So why? Because when you're feeling that flutter or bubbly movement or gentle taps, something, you just know that something is alive inside you. You see, that is why I will never understand why people will end up doing D and C. I will never understand that. I will never understand. Of course, I know there are those who will have to do it because of health conditions. But for those who just, because they can, they just terminate the pregnancy in D and C. I would to God you see what you're doing. Right? Stop it. Just in case you have planned to go tomorrow, go and go D and C, stop it. Because just imagine, how can you have this kind of early connection and you still said you don't want? Why? Why? What happened to you? There's no humanity in you. That's what it means. Anyway, let's not blackmail them. So I said all that to say this is usually the first emotional connection because something is alive inside you and growing. And once it starts, it doesn't stop. It doesn't stop at all. Now, what is happening inside the baby's body? Now, we've talked about what you feel. So what about the baby's body? What is happening inside the baby's body? Let's start with the brain. Right? Let's start with the brain. What you have in the brain is rapid growth. Brain continue to develop. Rapid growth. In fact, the sleep and wake pattern, early sleep and wake pattern, this is where it's formed. Yeah, this is where that circadian rhythm of sleep is formed. But it's unfortunate. Should I say fortunately or unfortunately now? It's fortunate. It is in the reverse when babies are in the womb. That is why you'll notice at night you feel as if they are fighting Iraq and Iran war in your tummy at night. When the mother is supposed to be sleeping, you are feeling bish, 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 all over the place. Right? Then when the mother is now awake and she's going about doing her business, everywhere is just quiet. So that is where that's where the baby is forming his sleep and wake rhythm, right? But interestingly, is on the reverse. It's on the reverse. Active at night, quiet in the daytime. And you begin to wonder, is it not this baby that was kicking as if heaven wants to fall down at night? Why is it so quiet? They are forming their rhythm, right? So in this is the stage where, because of brain development, the early sleep and wake pattern is being formed. And again, because of that same growth, brain development, there is sensitivity to sound and light. I hope you know that your baby is sensitive to sound. You see why sometimes, some people in those therapy will tell you, don't say curse words, don't quarrel, don't, or play nice music, or say something nice to your baby, right? Why? Because this is where it all begins. This is where it all begins. And it's smart for you to introduce them to those sounds that are good, that are not destructive, very constructive sound, music, motivation, um, and all those things that helps the human mind, right? To be smart. They also respond to light at this stage. Some mothers have actually said that they notice their baby move when they put the flashlight on their tummy. The baby respond. Why? Because of course at this stage they begin to they have sensitivity to light also, and sound. So you want to take advantage of their early growth, and that's what knowledge does for you. At this stage, your baby can now hear your voice. I hope you know your baby can hear your voice. Don't be the kind of mother that is cursing all over the place. You say all the bad words. Imagine what you are teaching this baby right from the womb. Everywhere you go, you curse, fighting, rancor, all over the place with your big tummy. What kind of mother is this? Right? Because your baby hear your voice. Even when you cry, your baby knows you are crying. When you're happy, your baby knows you are happy. Right? Your baby knows. And also, men, this is not the time. I've always said time and time again, when it comes to fertility and having baby, you want to try as much as possible to to put aside all quarreling, acrimony, and disharmony. Sometimes it may be hard, but you try. Mama's flavor, I see you. Your baby hears your voice. Your voice is the first voice that the baby will hear before daddy's voice. Right? Here, the baby responds to sound. I mentioned that before. In fact, I was watching one movie years ago, where they were raising human beings in tubes, large tubes. What's the name of that movie now? Kyle XY, I think. Kyle XY. So they always play in the lab, play a certain music, right? And somewhere when the guy was actually harvested from the tube, he responds to that music. Because what they are doing on those movies are things that we know already biologically, so it's not out of place. Expose them to constructive sounds, right? Because the baby respond to sound. Even daddy's voice can be recognized at this stage. Have you not noticed, for those of you that are pregnant, the moment your husband steps into the house and maybe he's talking, the baby may leap for joy, right? By kicking. Have you not noticed? That is in a home where peace deal, not be a home where they are fighting like cat and rat. So of course the baby will move differently, wake and sleep, and I've mentioned all that. So these are the issues. So up to this point, if you understood anything, tell me in the comment section. Understood. Let us go to the next thing. Let's talk about heart and lungs. What's going on with heart and lungs? Do you understand anything? Those of you that are just coming, if you're just coming, I know you didn't learn anything, but don't worry, just stick around. So those that have been here, did you learn anything up to this point? Understood. Thank you. Thank you very much. All right, so let's talk about heart. Let's talk about heart. You are just coming. No worry. Tomorrow, 7 p.m. Don't. If you are in Nigeria, 7 p.m. If you are in Mauritius, 10 p.m. Depend on your time zone. So just make sure you stick around. You will learn something. Is that Vicky? Vicky is here. You're welcome, Vicky. Good to see you. So let's move on. Let's talk about the heart. Remember, the heart has already been established. All right. Oh, you're in Germany, your boss. Was it you that asked the question? I'm not sure. I've got some viewers from Germany. I don't think it's you. Anyway, doesn't matter. We'll answer your question tonight. Oh, it was you. Okay. Okay. All right. We'll continue from where we stop. Right. So at this stage, the heart is fully formed. The heart is fully formed at this stage. Is pumping strongly. Is rhythm is steady at this stage. All right. Um, the blood, the pumping of blood across the body is efficient at this stage. Doctors often would listen closely now, whether they are using the fetoscope or they are using ultrasound measures, right? They will listen closely in this stage because when the heart structure, this is when the heart structure becomes very clear and well understood. Is that okay? So these are kind of things the doctor will be looking for. Yep. In this case, or in this stage also, now the lungs is established. The lungs is already formed, but it cannot be used yet. Why? Because it's inside, the baby is inside water, and there will be no need for lungs since it's inside water. But the baby on its own will be practicing the breathing movement, and that is one of the things that forms what we call biophysical profile when we examine your pregnancy, right? Because the baby will be practicing breathing movement on its own. You think the things, have you not often wonder who taught the baby how to breathe? Who taught the baby how to suck breast? Right? they spent 9 months, no, less than 9 months, rehearsing what they will come and do when they eventually emerge. So the baby is practicing breathing movement, right? And that also will help to strengthen the structures that will be needed for birth, right? Because every practice breath is a rehearsal for life outside the womb, right? So everything that is going on there is actually by design. It's actually by design. There's no mistake in human biology. There's no mistake at all. Yep. Okay. Thank you very much for the follow. All right. So that's the lungs. That's the lungs. Now, what about the placenta? And I've also said that this is the stage where the baby also learn to swallow. They learn to swallow. They swallow. They do all those movements because of their rehearsing. They rehearse. So let's talk about the placenta, the baby's personal life support. Placenta is baby's personal life support, and this is the what you want to call it the life support machine in the womb. Yeah, that is life support machine in the womb. You want to think of the placenta as it serves all the purposes, right? It's the baby's lungs, it's the baby's kidney, it's the baby's kitchen, even pharmacy. Everything is inside that lungs, right? Inside the placenta, everything is there, right? That is where the baby feeds. That is where the baby removes waste. That's where the baby sends oxygen, receives oxygen, and also sends his carbon dioxide or excrements, right? Placenta produces hormone that supports the baby. The placenta shields the baby against many infections. Like when we were talking about early pregnancy, we talked about how that even HIV cannot cross the placenta barrier. Usually, when you see a child born with HIV, it was not because it was infected in the womb. No, it was during delivery that the infection happened, not from the womb. So placenta does a lot of job, right? And the mother's blood does not mix with the baby's blood. So mothers, point of correction, it is not your blood that is flowing inside your child, right? Just to disappoint you, it's not your blood that's inside your child. Your baby came with their own blood, all right? The yolk sac was the first producer of their blood cell. Then when their bone started forming, it took over the production of blood. So they have their own blood, you have your own blood. Your blood will bring nutrients, will bring oxygen, and all what is necessary for baby survival. When it gets to the placenta, it stops there and throw it to the baby's side. The baby's blood will bring excrement, carbon dioxide, and all the waste, gets to the placenta, stops there, and throw it to the mother's side. So that's where the exchange happens, right? So the next time you want to blackmail your baby, say your blood runs in mine. It's not true. But if that will make them hear you, it's okay. But never use that against them with respect to their daddy. Is that okay? All right. So where was I in the gist? So I was talking about how that even something as much as HIV cannot cross. It doesn't cross. They don't get infected in the womb, but usually most of the infection happens in the time of delivery. That's why special care is taken for when they are delivering those who have HIV. So if the placenta works well, the baby will thrive because of the all-important job that the placenta does. But if the placenta struggles to function, oh boy, your doctor may just start paying close attention to see where to help, because we don't want anything to go wrong, right? Just like saying for some reason your stomach is no longer working. Where will you get nourishment from, right? So placenta, nothing should happen to the placenta. So do we understand anything up to this point? Talk to me. If you understood anything, just type understood so that I'll know you are there. 33 people in the viewers, please make sure you're talking to me. I want to be able to know your name, remember your name, right? It's easy for me that way when you comment. Is that okay? So before we go to the next thing, can you just tell me that you understood something? But if you're just coming, you did not understand anything, don't type anything, because you have not learned nothing tonight. Yes, that's a very important question, Debbie. Debbie, I wish you would wait until the end of when we get to Q&A. I wish you would. I want to answer this question. This very important question you just asked, right? Oh boy. So let's move on. So please tap on your screen. Tap on your screen. 30 people. If all of us tap on our screen in less than 2 minutes, we will hit 50k likes. I tell you the truth. Not for me, but it gives us visibility for others to see us. There are people who are suffering in ignorance, and that is what this live stream is all about, to bring people, yank them out of ignorance, so that their tears will dry, because they don't know. Say, oh God, why me? Why is this happening to me? Well, it's because you don't have knowledge. So let us give you knowledge that will help. Sima, good to see you. So let's talk about what changes for the mother? Now you've arrived at second trimester. So what changes? All what we've talked about is the baby, the baby, the baby. So the mother, what? Excuse me. What changes for the mother? Let's start with physical change. Then we'll talk about emotional change. Is that okay? Is that okay? Let's talk about physical change. Then we'll talk about emotional change. All right. If you're just joining, it's smart for you to drop a heart me, join the fan club, follow me, tap on your screen, and don't miss the live stream. 7 p.m. Nigerian time, Monday to Fridays. All questions will be answered at the end of the discussion. Is that okay? So you're welcome. So physical changes that happens in the mother in this second trimester. Of course, the belly begins to show. There's an African proverb that says, you can never hide the pregnancy. Is that not wonderful? You can never hide pregnancy because it will show. So this is where it begins to show, right? The breast grows and feels heavy, right? Of course, because of what you've had to go through in the first trimester. At this stage now, the body has adapted and your energy begins to return. Your energy begins to return. Just very few people that may be sick for a very long time. But majority of the people, your energy begins to return at the second trimester. And guess what? Your appetite improves. All those symptoms of early morning sickness have actually passed away. A new category of experience have started. For many women, they will say, I finally feel like myself again. Right? Because early, what do you call that? Early morning sickness or morning sickness finished them. But now they're beginning to feel like themselves again. And more than 70% of pregnant women would say things like, this is the most comfortable stage of pregnancy, more than 70%. Why? Because it's actually a comfortable stage. So that's basically what mothers begin to feel physically. Is that MSEG? MSEG is here. Emotionally, right, you have less anxiety. Thank you very much. You have less anxiety. Bonding is more at this stage. The fear of you have less fear of miscarriage. This is no longer the stage of high risk anymore. First trimester was a high risk stage, but now the fear of miscarriage has reduced. It's still there, but it has reduced tremendously, and there is a growing excitement. Now this is the stage where you go for antenatal, you see other women, you are not sickly, you're now thinking, you're having discussion on the type of clothing you want to buy for your baby and all those kind of things. So the pregnancy shifts from fear to anticipation. Fear of losing the pregnancy, fear of the unknown. Now it's time for anticipation. You anticipate. Is it going to be a boy? Is it going to be a girl? Is it pink I'm going to be buying? Or is it blue I'm going to be buying? Is it this type of clothing? It's more of anticipation at this stage, right? And it's a big deal. It's a big deal. The excitement is palpable. It's palpable, especially for the first time mom. Yeah. Um, between 18 weeks to 22 weeks, your doctor will perform what we call anomaly scan. Anomaly scan. I remember one time I was called to a certain facility, and I think the lady came on her own, basically. Maybe she has heard stories. And then they called me, said, please, we have a situation. Somebody's requesting for anomaly scan. Could you come and help? I said, okay. So when I got there, it was still in my early pregnancy. I said, who requests you for this scan? I just knew from all her stories. I just knew that she came on her own because she must have heard something about anomaly scan. There was no details to the statement. So she just jumped in. So she was not ready. She was not ready for that scan yet, because anomaly scan will be within this time bracket, right? Where the doctor will perform a very detailed, very meticulous ultrasound examination to rule out a lot of things, right? And this scan looks at the brain, any anomaly or abnormality in the brain. Good evening, Mercy in Jang. Good to see you. You're welcome. Look at the brain. You look at the spine. There's any abnormality in the spine. Look at the heart. There's any abnormality in the heart, right? You look at the kidneys. If there's any abnormality in the kidneys, there could be, right? These are not the things that your doctor will sit you to explain to you, but I'm telling you. So that's why anomaly scan is key. I think here in Nigeria, we don't specific in most cases. I've been around for a very long time, so I can tell. They don't specifically request for anomaly scan. But if you go to a place where your doctor or sonographer knows what he's doing, he should know that at this stage this is what he's looking for, right? So more likely you'll be paying less, because if you actually go there asking for an anomaly scan, you pay big, right? But if you come to someone like me, I don't care. I just want to. The success of your pregnancy is more important to me than what you're paying. All right. So they'll look at the heart of your baby, 4 chambers, and several things they look at. They also look at the limbs. Look at the limbs. Look at the feet. Look at the hands. Right. They also look at the face. Right. Even the placenta location. That's why I ask. I don't know if she's still here. She asked a very important question, and I want her to ask that question again when it's time for questions, because I want to use that question to answer something. So anyway, so this anomaly scan looks at all these things, because for example, when the baby have club feet, foot, it tells the doctor something is wrong. All right. This is a stage where you can see a cleft lip or even cleft palate. Right? It's a stage where you can look at abnormality around the head, even the spine. Right? Where you can even have a fluid accumulation. Several things. That's why it's done. That's why it's done. Right? So this is in this stage, one big question must be answered. Century, thank you. One big question must be answered in this stage. Is the baby growing the way nature intended it to grow? That is the thing that will be answered. Is the baby growing? If it's not, then report it to your doctor and begin to look at what measures or advice, or how do we begin to prepare your mind for what is to come. Good evening, Chichi. I see you. Right? So for many parents, this scan will turn their imagination into reality. Because now we are now showing you something that looks like this on my screen. Every aspect of this baby is examined, and that is anomaly scan. Is that okay? All right. If you're still here and you're understanding what I'm saying, please come talk to me in the comment section. Just type "I hear you." Let me be sure you are here. Type "I hear you." And if you're just joining, please make sure you're tapping on your screen. If you've not dropped a heart me, I wonder what you're waiting for. In fact, why are you like this? Right? All right. So let's quickly look at I'm thinking whether I should or I should just pack up at this stage. There's still a few more. Okay, before I talk about problems, let's talk about depends on your sanctuary. It depends on the facility and the location, right? Depends on the facility or the location. So you want to go to the facility close to you, so they will tell you what is needed, right? So it's not just a blank price or a standard price across the world or across the country. It depends on the facility. Is that okay? So gender selection can be done, right? All right. So let's talk about nutrition before I go to problems that can still appear in second trimester. Remember, I said this is a place where you feel more relaxed. Doesn't mean that it's void of problems. Problems can still occur. Is that okay? So let's talk about nutrition first. So this is the this stage is the growth trimester. Second trimester is the growth trimester. Please, if you are here, 28 people, make sure you are connecting with one another. Grow your account. I'm not a grow host, otherwise I would have said grab for grab or what. I don't know that thing they used to say, but just make sure you grab and tag, right, so that you grow your account. Grow your account. Connect to somebody, tag them so that they know they can grab you back. And if they refuse to grab you back, by tomorrow morning, go and ungrab them, because nobody has the monopoly of not following anybody. So let's continue. So I was saying that this stage, second trimester, is the stage of growth. Is a growth trimester. At this stage, the baby now needs protein for tissue to grow. When they are growing, so they need protein, right? The baby will need iron for blood, right? If you were here when I was talking about nutrition, you already know what I'm talking about. They need iron for blood. They need calcium. The baby needs calcium for bones, right? Baby need calcium. My favorite grandma is here, Global Uzi. Welcome in, Global Uzi. I greet you. Compliment of the season. All right. So, but anyway, globally, right? Iron deficiency affects nearly half of the pregnant women, especially where nutrition is limited. In fact, trust the global bodies, they will say it's always in Africa that we have deficiencies. I think most of the things they do for you in antenatal is to educate you and also give you drugs that can help. So you want to follow your doctor's directive, right? Because what the mother eats in the second trimester builds the baby's future health. So if you starve your baby of nutrition, the outcome of the baby, it will show. If you nourish them well, it also show. So you want to do well to make sure your baby get the best. It's not when you now deliver and now spending millions of naira buying all. It starts from the womb, right? So you want to give them the best from the onset, right? So now let's talk about, before I end this discussion, I want to start taking questions. But before I want to just point to us problems that can appear in the second trimester. Even though it's an easy trimester, problems can still appear. Is that okay? It's a stable trimester, but again, it's not the time to be careless because problem can still occur. Right. The second trimester, some conditions may appear quietly. Some conditions can quietly just appear. For example, high BP, yeah, high blood sugar, weak service, what we call incompetent service, right? Even poor placental attachment. That is why your antenatal visit is very important. And do not be worried when your doctor send you for some examination like scan. They need to be sure what they are dealing with. All right. Even when you feel fine, your doctor may still want to get a confirmation of what is going on with you. So because they want to be looking at they're taking your BP to be sure what's going on. They're looking at your blood sugar. They're looking at your cervix, right? They're looking at the placenta attachment and several other things that they'll be looking at. So these are the issues and many more. Because tomorrow we'll continue to build on these thoughts. So at this point, I hope you have learned something. If you have questions, this is the time for you to send your request and ask questions.